Hello, today is my community health speech. I do apologize. I am fighting an illness, so please bear with me. I will try to be as clear as possible. Here are my two audience members today. Thank you. An epidemic is a scary word, especially in this trying time we are currently living in. Our minds inadvertently go right to what has spread into a pandemic these last couple of years, COVID-19. But what about the epidemic no one is talking about? The crisis that has gripped our nation long before COVID ever took hold and has claimed thousands of lives. By the time we reach adulthood, nearly every person in America has seen a doctor. Most likely during those visits, those individuals were prescribed a medication at one time or another. For much of the population, this includes a pain medication. Americans are dying of an opiate addiction at a disturbing rate. We have seen especially high usage in Kern County. Today, we will look at what has caused the opioid crisis, what Kern County officials can do to help curtail this opioid crisis, and how providers can successfully treat those with chronic pain without adding to the problem. But how did Kern County get to such an extreme epidemic so quickly and so far out of control? America has come to be in the grip of a prescribed nightmare in just 20 years' time. Alarmingly, the United States is the leader in countries consuming the most opioids. The US by far has the highest number of users of addictive pain medication. According to the 2021 website for the National Institute on Drug Abuse, in the late 1990s, pharmaceutical companies reassured the medical community that patients would not become addicted to prescription opioid pain relievers, and healthcare providers began to prescribe them at a greater rate. This subsequently led to a widespread division and misuse of these medications before it became clear that these medications could indeed be highly addictive. At this point, the damage had been done. A dam had been opened, and now the healthcare industry is scrambling to get it under control to not only save these people that drugs hold hostage, but also prevent more people from falling victim to these medications. Kern County has been hit very hard by the opiate epidemic. According to the Kern County Coroner's Office, there is a 30% increase in overdose deaths in the first year of the pandemic compared to the year prior. In Kern alone, we have seen a high rate of opiate overdose deaths, a death increase of 48% from 2017. And we saw opiate admissions for treatment surpass meth admissions. On the 2021 CDC website, it states by 2014, almost 2 million people either abused or became dependent on opiate pain medication. The number is growing steadily at a rapid rate marked from 1999. The site goes on to say from 1999 to 2019, nearly 500,000 people died from an overdose involving any opiate, including prescriptions. While it may not seem like it, dependence on a medication and abusing a medication are two separate things. It can be a little difficult to understand. Dependence is when a person becomes physically dependent on a substance. It's portrayed by symptoms of tolerance to a medication and withdrawal when a medication is not taken. Many people have a dependence on these medications without being addictive, although addiction is likely right around the corner for those that take these medications regularly. It only takes 5 days of opiate use for dependence to occur. 5 days. 5 days of taking the medication just the way your doctor prescribed it. 5 days for your body to need it. 5 days for you to have withdrawals when you stop these medications. That's a scary thing. Now we are starting to see why this medication is such a slippery slope. Now that I have discussed how addictive opiates can be and how badly the opiate crisis is in America and Kern, I'd like to talk about what efforts are being made to combat this. So what do we do now? How are policymakers and those in the medical profession helping curtail the opiate crisis in Kern? The federal government is actively working on ways to help support ending the opioid crisis in America. The article written in 2017 by Shalini Wickramalake in Public Health Report also states, as part of this effort, in 2015, the Department of Health and Human Services developed a three-pronged initiative focused on educating providers about safe prescribing of opioids, increasing access to medication-assisted treatments, and raising the use of naloxone. With the opioid deaths continuing to rise in all states, the states have begun several efforts to combat this issue. Kern County has several groups committed to helping locally, one being Drug-Free Kern. The behavioral health of Kern is also putting forth a lot of effort to try to help these people. There is free assistance for those that seek it. The tricky part is getting those who are addicted to admit that they have a problem and to seek the help. That by far is the most difficult part of it. There are hotlines on the websites that you can look up. Those without internet access can also walk into their facilities. You could walk into a hospital, ask for help, a KMC, or any hospital really, and somebody will call and help you get some services. Kern needs to and is utilizing federal grants to help fund the community's battle against the opiates, and they're throwing much of their efforts into education for its residents. They really need to ensure that the public is well informed. Many people are surprised how quickly you become addicted. That's taking the prescriptions as prescribed is not generally how people think of an addiction or how somebody becomes addicted. We have a whole different story and map made up in our mind about how addiction happens. But a huge majority of these people were taking their medicines as prescribed by their doctor and became addicted. If the public knew more about these medications and the body's chemical response, then perhaps people would protect themselves more. It's critical to ensure that there are enough NA meetings in Kern or other free access to support programs for the community. I don't believe Kern has enough of those. I did a search to look for NA programs, and it doesn't appear that there's that many, not throughout. They're mostly localized to one portion of the city, which could be difficult for people who may not have vehicles or a way to get there. In 2016, the CDC released a guideline for prescribing opioids for chronic pain. The guideline was thought to be helpful by many, but it has not been widely accepted for use, as a lot of people are demanding more research. The guideline has been shown positive results, though, for the medical centers who are implementing it. They only prescribe opioid-based pain medication for no longer than 3 days, although this can be altered by case. This has become seen more as a standard of care, and Kern County needs to be active in ensuring the providers and healthcare centers are utilizing and are aware of this knowledge. Physicians need to be educated on the difference between acute pain or chronic pain. Acute pain being something that will resolve itself with recovery, and chronic pain is much more complex and affects the physical well-being and will take a large toll on somebody's physical or mental well-being. Americans are dying of opiate addiction at an alarming rate, a surge that has been developing for over the last 20 years. There's a tremendous need to find a way to confront the epidemic while still successfully treating pain sufferers. Today, we have looked at the crisis we are battling across America. We have learned how such a thing has ravaged our own county, and we have learned how medical providers take steps to remit care without adding further to the opiate epidemic. We've explored how doctors can treat those with chronic pain without using opiates. Knowledge is power. Every person must be their own advocate for their health, knowing what a medication will do before you decide to take it. Awareness can go a long way in preventative measures. Be mindful and ask the questions. We can avoid adding to the epidemic and look forward to a healthier future with our choices. On my screen right now are a few local help centers. If this is not up long enough and you do need additional care, screenshot this, or I'm happy to share if you reach out. Thank you.